All right, today we're going to journey deep inside the brain to uncover this just elegant and complex system that controls your every single move. It's a story about permission and suppression, about balance and incredible precision, and it's all happening faster than you can even blink. So let's dive in and meet the gatekeeper. I mean, really think about that for a second. Right now, your brain is just flooded with countless potential actions you could take. So how does it pick just one, the one you actually mean to do, while shutting down all the others? This incredible filtering is happening every moment of every day, and it's all thanks to a hidden gatekeeper deep inside your head. So here's what we'll cover in this explainer. First, we'll meet that gatekeeper. Then, we'll look at the two opposing circuits it uses, a go pathway to green light actions and a stop pathway to block them. We'll see how dopamine acts like the master conductor of this whole orchestra. And finally, what happens when this delicate system, well, breaks down. Okay, so our story starts with this group of structures tucked away deep inside the brain called the basal ganglia. Now, they're not the command center that decides to move. They're something way more subtle, way more interesting. They're the bouncers at the club, the gatekeepers that decide what moves. This is absolutely crucial to understand. The basal ganglia don't create the urge to move. That signal comes from higher up, from the cortex. What they do is act like a really sophisticated selection system. They look at all the potential movement plans the cortex is throwing at them and decide which one gets the green light, while making sure all the competing, unwanted actions are held back. They are, without a doubt, the ultimate gatekeeper of motion.
So how do the basal ganglia actually say yes to a movement? Well, they use a specific circuit called the direct pathway. You can think of this as the express lane for a motor command. It's designed to release the brakes and just let the action happen.
The key idea here is this really clever trick called disinhibition. So to get it, just imagine the system has a default brake that's always on. That brake is a structure called the globus pallidus internus, or GPI. It is constantly telling another area, the thalamus, don't move, don't move. So to get that go signal, the cortex tells a different region, the striatum, to inhibit the inhibitor, basically to shut off the GPI. This lets go of the brake on the thalamus, which can now shout, go, back to the cortex, and just like that, your arm reaches for that cup. But for every single yes, the brain has to say no probably 1,000 times. And to do that, it uses a competing circuit, the indirect pathway. If the go pathway releases the brake, you better believe this stop pathway slams it right to the floor. Now, this circuit is a little more winding, a bit more complex, but the end result is what really matters. It's another one of these clever double negative chains. The signal goes through a few extra steps involving the globus pallidus externus and the subthalamic nucleus. But the final punchline of this chain reaction is that the subthalamic nucleus excites our main brake, the GPI. This makes that brake even stronger, making absolutely sure the thalamus stays quiet and no unwanted movements slip through. So let's just put this all together for a second. The go pathway, its whole job is to release the brake. The stop pathway, its whole job is to apply the brake. And what we call normal, smooth, purposeful movement, well, that's just the result of a perfect dynamic dance between these two opposing forces. One selects the action, and the other carves away all the noise. But how is this perfect balance actually maintained? I mean, who conducts this orchestra of go and stop signals? Well, the answer is one of the most famous neurotransmitters in the brain, dopamine. And this is where the system is just, it's genius. Dopamine doesn't just push one lever, it does two things at once. When it's released from a place called the substantia nigra, it hits two different kinds of receptors. On one hand, it stimulates the D1 receptors, which juices up the go pathway. And at the exact same time, it hits the D2 receptors, which inhibits the stop pathway. So dopamine effectively presses the accelerator and lets up on the brake simultaneously, making sure that the movement you want to make comes through loud and clear. I mean, this whole system is a masterpiece of equilibrium, right? A little more go, a little less stop, all orchestrated by dopamine. But what happens when the conductor stumbles? What happens when this beautiful balance is completely broken? Well, when the balance breaks, we tend to see two major categories of movement disorders. The names might sound a little complex, but the ideas behind them are actually pretty straightforward. Hypokinetic, which just means too little movement, and hyperkinetic, which, you guessed it, means too much movement. You know, it all comes back to our brake analogy. In hypokinetic disorders, the whole system is biased towards stop.
The brake is essentially stuck in the on position, which makes it incredibly hard to get a movement started. But in hyperkinetic disorders, the system can't generate a strong enough stop signal. The brake is faulty, it's broken, and that allows all these unwanted, involuntary movements to just burst through.
Parkinsonism is really the classic example of a hypokinetic disorder. The core issue is the death of those dopamine-producing neurons we talked about. Without enough dopamine, the go pathway gets weaker, and the stop pathway just runs wild, totally unchecked. The end result is that the GPI brake becomes way too powerful, and it puts the thalamus in a stranglehold. And that is why patients experience that hallmark slowness, rigidity, and difficulty getting movements going. The system is just screaming stop all the time.
Okay, so now let's flip to the complete opposite problem with something like chorea, which you often see in Huntington's disease. Here, the problem isn't dopamine. It's the degeneration of the neurons that actually make up the stop pathway itself. It's like the brake line has been physically cut. And because of that, the GPI can't effectively put the brakes on the thalamus, allowing all these random, unwanted motor programs to escape and get executed. This is what causes those characteristic jerky, involuntary movements.
This table really just lays it all out perfectly. You see, in Parkinsonism, you have dopamine loss, which leads to an overactive stop pathway, which leads to too much inhibition on the thalamus, and the result is too little movement. In chorea, you have the loss of cells in the stop pathway itself. That leads to an underactive pathway, not enough inhibition on the thalamus, and the result is too much movement. It's two different problems in the exact same circuit, creating precisely opposite outcomes. You know, maybe the best way to think about the basal ganglia isn't as an engine, but as an artist. Imagine the cortex provides this big, unrefined block of marble. That's all the possible things you could do. The basal ganglia then act as the sculptor's chisel, skillfully and precisely chipping away every single thing that is not the intended action, until only the desired, graceful movement is left behind. Understanding this incredibly intricate balance between go and stop isn't just some academic exercise. It's the absolute key to developing therapies that can help restore that balance when it's lost. And it leaves us with this fundamental question that drives so much of neuroscience and medicine forward. How can we help the brain rediscover its rhythm and find that perfect balance once more?